Okay, everyone, I'm so excited. We've made it to the evaluation step or the last step of the nursing process. As they say, nursing process is ADPI. A for A, D for delicious, pie for pie. So you've finally gotten to eat your pie. I know that's a corny joke, but add pie, that's how you can remember it, a delicious pie. So we're finally eating the last part of our pie. Okay, so let's talk about evaluation. Evaluation, we're going to look at the achievement of our outcomes. It's going to help to direct nurse patient interactions because depending on where we're at in the plan of care, if they've met their outcomes, if they're still working on them, if they're going to be discharged, kind of depending is going to direct more interactions. If we need to intervene more, we're obviously going to directly intervene more with them. If we're not having to intervene more and everything's okay, we might not interact as much with the patient and eventually they'll be discharged home. We can measure patient outcome achievement, we can identify factors to achieve outcomes, and we can modify the plan of care if necessary. So we're going to be talking about all of these things in a little bit more detail as we move through the slides. Let's do a little quick knowledge check here. The purpose of evaluation is to allow the patient's achievement of expected outcomes to direct future nurse-patient interactions. True or false? If you said true, you're absolutely correct. Remember, evaluation is going to allow us to help our patient meet their outcomes, and it's going to direct how much we have to interact with them and help them. So if they've met their outcomes, maybe we interact a little bit less, but if they're needing more interventions, then we're interacting with them more. Okay, let's talk about what you would do based on the patient's response to the plan of care. We can do three things. We can terminate the plan of care when each of the expected outcomes is achieved. We can modify the plan of care if there are difficulties achieving the outcomes, or we can continue the plan of care if more time is needed to achieve the outcomes. So termination would be something like the patient, has met that outcome. We no longer need it, so we're going to terminate it and maybe make a new outcome, or maybe we're done with that area. And we don't need to worry about more outcomes. We can modify, so we can modify either the outcome itself, the interventions, the any part of the plan of care. We can modify even the diagnosis. We can go all the way back to that portion of the plan of care for the patient. Or we can continue. Sometimes we just need a little bit more time. And I'm going to show you examples of each of these to help you see how you would write each of these things out. So let's do a quick knowledge check here. Which action should the nurse take when a patient has achieved each expected outcome in the plan of care? Shall we terminate the plan of care? Shall we modify the plan of care? Or shall we continue the plan of care? Hopefully you said A, we're going to terminate because we've met all the expected outcomes. Okay, so we no longer have to continue, and hopefully maybe they'll be going home at that point if we've met all of those outcomes. Four types of outcomes just to revisit this, and there's one added here. Remember, we had our cognitive, which was increasing the patient's knowledge. So maybe patient states 3 ways to prevent pressure ulcers. We have our psychomotor, where they're going to achieve a new skill. Maybe they're demonstrating appropriate injection technique. Affective is going to be a change in the patient's values, beliefs, or attitudes. Maybe they verbalize a decrease in anxiety. Or physiologic, that's more related to the physical changes in the patient, such as they've decreased their weight by 10 pounds, or maybe there's something else physical that they've done, or we've written an outcome for them and they've met that. So a little knowledge check here. Which of the following represents a psychomotor outcome being met? Is it A, a patient learns how to control his weight using the My Pyramid food guide? Is it B, a patient is able to test for glucose levels and inject insulin as needed? C, a patient values his health enough to decide to quit smoking? Or D, a patient is able to ambulate the hallway following surgery? If you said B, you're absolutely correct. A patient is able to test for glucose level, inject insulin as needed, is definitely falls under the psychomotor outcome. Remember that anything that has to do with knowledge, gaining more knowledge is cognitive, affective is going to be a change in the values, and physiologic is a change in the physical portion of the patient. So what are we going to do when we look at our care plan? or our plan of care. We're going to evaluate if our outcomes were met. What you need to do is you can do three things, okay? When you say if your evaluation was, if your outcome was met, you can either say that it was met, it was partially met, or it was not met. So those are the three statements that they would have in the plan of care when we chart. Then we're going to list the patient data or behaviors that supports this decision. Okay, so we're going to say goal or outcome was met because of this, outcome or goal was met, partially met because of this, or goal or outcome was not met because of this. Okay, so those are the three. 1, 2, 3. Now let's go forward and see some examples. Okay, so the goal for this is straight out of the textbook actually, but the goal potentially could have been patient will stop smoking cigarettes by x of xx. We don't know the date and time, and you'd put a time here, like whatever time you want to put, you'd put in the circle there. Okay, so our outcome for this patient that we're working with is that they will stop smoking cigarettes by this time on this date. Okay, now, and what we could do, so remember, we can even add a condition here. So here's our subject, here's our verb, will the stop. Our condition could be we want them to stop smoking, but we could say with or without maybe medication use or the patch or something like that. So that's where your condition would come in. Okay, and our performance criteria is to stop smoking, and our time frame is by this. So remember, the outcome statement has to have all of those things. We have to have a subject, a verb, a condition, a performance criteria, and a time, and we have all that. Okay, that was just a review for your writing outcomes. Very good, guys. All right, so let's look and see if this outcome was met for the patient. There are three examples here. Remember, we can do one of three things. We could do 1, 2, or 3. So 1, the outcome was met. The patient reports 1 week of no tobacco use. Perfect. So that's, great. They met their outcome. They have no tobacco use. 2, the outcome was partially met. The patient reports decreasing tobacco use from 1 pack per day to 4 to 6 cigarettes per day. The nurse is going to continue to implement and monitor plan. Great. All right, they made some progress there. We're proud of them for their progress, and we're going to just continue to do what we've been doing. This outcome, number 3, was not met. Patient reports no change in tobacco use. Revision to the plan is that maybe we re-explore the patient's commitment to try tobacco use control strategies and adequacy of personal support system to eliminate tobacco use. So the patient has not met the goal or the outcome. There is no change, so they're still smoking the 1 pack a day. Okay, so that's kind of how you can write those out, either met, partially met, or not met. So when you go to revise your plan of care, there's a few things that you can do. You can either delete or modify the nursing diagnosis. You can make the outcome statement more realistic, maybe by changing, even the time frame, or maybe what you're having the patient do. So maybe with the patient with the smoking cessation, maybe it's not realistic that the patient goes from 1 pack to none. Maybe it's that the patient goes from 1 pack to less cigarettes, and that would be more realistic for that patient. Making outcomes more realistic also encourages the patient because they're meeting those baby step type goals, and it makes them feel empowered. So if we write that they're going to completely stop smoking, they might feel like they can never do that. But if we say, hey, do you think you could reduce your smoking from a whole pack to this many cigarettes, they might go, oh yeah, sure, I can do that. So think about realistic expectations as well. And then increase the complexity of the outcome statement. So maybe we add things to the outcome statement if we want to push them a little bit more. Adjust time criteria in the outcome statement. So maybe they just need a little bit more time. Like in the second example that we had where the goal was partially met, and the nurse said that they're going to continue the plan. It's because the patient just needs a little bit more time. So we might adjust the time criteria if needed, or change nursing interventions. So maybe what we're doing is just not working. Maybe by just not providing support or something like that that the patient needs, we're not intervening well enough to help them to meet their outcome or goal. Let's do a knowledge check here. An outcome evaluation focuses on measurable changes in the health status of the patient or the end result of nursing care. True or false? It is true. So we're looking at evaluating, did they have a change in their health status? Did they stop smoking? Did they have a reduction in pain? Were they free of infection? So all of those things we're looking to evaluate if what they have the problem with is gone or reduced. Another little knowledge check here. Your patient has met the outcome set for improvement of ambulatory status. Would you A, modify the care plan, B, discontinue the care plan, C, create a new diagnosis that states goals have been met, or reassess the patient's responses to care and evaluate the implementation step of the nursing process? If you said B, you're absolutely correct. Remember, they've met their outcomes, so we can go ahead and discontinue the plan of care, and hopefully they'll be going home after meeting most, if not all, of their outcomes. So let's look at how would you evaluate if Miss Carla Tompkins met the outcomes that you established for her. To do this, we're going to have to go back to our concept map that you've so wonderfully written out for Miss Tompkins. So we're going to look at this concept map, and we're going to say, you see this last part right here is going to be our evaluation. Okay, so we're going to look and just to refresh our memory a little bit, we wrote the outcome or goal that the patient will state a decrease in pain to 4 out of 10 after pain medication administration. So that's our outcome, okay, or goal. Now, we went ahead and we intervened. So I know that Miss Carla Tompkins is not a real patient, and I know that we truly didn't intervene with her because she's not real, so we couldn't really do anything with her. When you're in clinical, however, you'll have a real patient and you'll be able to intervene. You'll be able to work through this process with them and this plan with them, and you're going to collaborate as a partner with them and really help them to meet the outcomes that you've set for them for that clinical day. So I know it's harder when it's a case study or a virtual sim or something like that, but this will be a good stepping stone for you to be able to then take this forward to when you actually are working with real patients. So let's talk about, we're just going to pretend, I know it's hard for some of us to do, but we're going to pretend that we have Miss Carla Tompkins here. We've had our shift with her, and we're working on the goal or outcome of reducing her pain to a 4 out of 10 after we give her pain medicine. So we have to ask ourselves, did we assess the patient's pain using appropriate pain? Check, we did. Did we teach her? Did we educate the patient on pain medication? We did. And did we administer pain medication to the patient as prescribed? We did. So great. We did the 3 interventions that we thought we could do to help Mrs. Tompkins meet her goal or outcome. So now there's a couple things that you can do, and I'm going to write it over here. You can either remember, say the goal was met. It's actually outcome or goal. Outcome, goal was partially met, or outcome slash goal was not met. So remember, this is the 1, the 2, and the 3. The 3 choices we have. So let's talk about Miss Tompkins. We're going to help Miss Tompkins out here, and we're going to say that she met her goal. Okay, she had a decrease in pain to 4 out of 10. So we're going to go ahead and write goal met, pain 4 out of 10. Okay, what if it was partially met? Miss Tompkins is not having the best day today, so it's partially met. There's not a lot of room here to write. Partially met because pain 5 out of 10, and she continues to grimace in pain. Okay, so that's our partially met. And then we'll write our goal met. I'm trying to do this the best I can. Goal not met. Patient has a 7 out of 10 pain and increase, whoops, grimacing. So that's not good for Mrs. Tompkins. So if we see that the goal was met, we're good. We can go ahead and either terminate that, or maybe it's something long term because we said she would be free of pain by discharge. So we can continue to use that same goal. If the goal was partially met, we might need to do something differently. Why is it her pain still at a 5 out of 10? Why is she continuing to grimace in pain? Is it that maybe we didn't administer her pain medications at a time that was best for her? Did she wait too long to tell us she was in pain? Um, are we using a pain scale that doesn't work appropriately for her? Are we not assessing when we should be assessing 30 minutes to an hour after? Maybe we're waiting, too long or too little, and she's still in pain. And then pain goal not met, she has a 7 out of 10 pain still and increased grimacing. Something's not working for her. So maybe we're going to, for that one, we're going to call provider for some additional orders. Maybe she needs a different type of pain medication. Maybe she needs something else. Maybe there's something going on with the surgical site. Okay, so we'd want to maybe definitely explore why her goal is not being met. Same thing with the risk for infection. We can do one of three things. So we can either, I'm going to go down here actually, where there's a little bit more room. So we can say the goal was met. Patient has no signs and symptoms of infection. Goal partially met. Um, Increased drainage will continue to monitor. Depending on what that drainage looks like, maybe we're kind of concerned. We're not really, worried right now, but we're going to continue to monitor. Or goal was not met, unable to assess wound, and maybe the patient refused dressing change. Or maybe the patient wasn't available to do a dressing change, whatever we want to say with that. So you can see, guys, that we can either have our goal met, goal partially met, goal not met. We have to say why, and it's hard to make these up when you don't really have a real patient, but you just need to think about what you think you would see in a patient. And truly, when you're dealing with a patient in the healthcare facility, truly, looking at them, did they meet the outcome of patient will be free of signs and symptoms of infection by end of shift? Did they have an infection? No? Then your signs and symptoms of an infection? No? Then you know what? They met their goal. Okay? And you were able to do all of these interventions. Okay? Perfect. All right, guys, so you finally made it through your nursing process. Congratulations on understanding every part of it. Hopefully, you have a good understanding. And when we meet together, we will do another example. We'll work together and we'll hopefully get you really clear on how to write a nursing care plan. And please don't feel as if you have to know how to do this perfectly right now. We just work through one together, and it's something that's going to come with time. It takes practice. See you soon.